Just the words breast cancer have to be two of the most scary words that any woman can hear. And if you've been diagnosed or you know someone, you probably have a lot of questions. Breast cancer impacts 1 in 8 women during their lifetime, so it's one of the most common cancers that impact women. The good news is that if it's found early, the vast majority of women, over 90%, will survive for at least 5 or more years. My mom had breast cancer when she was 32 and she lived to be 77. There's a lot of things that impact a woman's risk to develop breast cancer, so let's break it down. Let's start with family history. There's something called first-degree relative. That's a mother or a sister. So a first-degree relative with breast cancer means that a person's at a slightly higher risk to develop it themselves. And it's really not important whether it's the mother or the sister. First-degree relative puts a person at increased risk. And if that's in your family history, then I'd highly recommend that you have genetic testing to see if you have one of the many different genes that have been identified that increase the risk. You may have heard of BRCA1 or BRCA2, the BRCA genes. These are the ones that are most commonly associated with breast cancer risk. But there are many others. And there are genetic profiles that can be done that include 39 different genes that have been identified. So if you have a first-degree relative, man or woman, who's had breast cancer, do ask for genetic testing. And if you haven't already signed up for the Wisdom Study, you can go to wisdomstudy.org. You can sign up for the study and you can access free genetic counseling and free personalized breast cancer risk assessment. What are some of the other risk factors? Well, as you can expect, lifestyle like diet and lack of exercise also impact the risk of developing breast cancer. Let's start with diet. A high-fat diet increases the risk, as does drinking 2 or more alcoholic drinks per day. So women who have more than 1 alcoholic drink per day or more than 7 per week have a 10 to 15% increased risk of developing breast cancer. Women who do not get enough exercise, that means not getting at least 3 hours a week or a half hour per day, also have about a 30% increased risk of developing breast cancer. So just by reducing alcohol intake and increasing exercise, any woman can reduce her risk of developing breast cancer. So if someone is diagnosed, oftentimes it's from a mammogram. So mammograms are a very, very safe way to look inside the breast tissue to see if there's any areas that are of concern. So I want to talk a little bit about that. When a mammogram is done, what we're looking for are white areas, kind of look like a snowflake. And because the breast is pretty fatty, in a mammogram, fat tissue doesn't show up on the mammogram, so it's black. And if there is like a snowflake pattern in that area that's black, it's pretty easy to see. If a woman has increased breast density, the breast will appear white. And so looking for breast cancer, which looks like a snowflake, is kind of like finding a snowflake in a snowstorm. So women who have increased breast density should have a mammogram and then an ultrasound to look to see if there's any areas of suspicion. What about women who are at higher risk? A woman who has maybe one of the genetic markers that increase her risk, or they have increased breast density, or maybe they've had a biopsy. What kind of testing do they need? We typically recommend that women have something called a breast cancer risk assessment. And your healthcare provider can plug in a lot of your personal data into one of the several breast cancer risk guidelines that we have. One is called Tyrer-Krusek. One is called the Gale model. And this helps us as providers determine, does this person need a mammogram every year? Do they need a magnetic resonance imaging or MRI every year? So there are many women like myself who get a mammogram and then 6 months later get an MRI, and then 6 months later another mammogram. So I alternate because I'm at pretty high risk of developing breast cancer. So if you're at high risk or you suspect that you are, ask your provider to look at one of those models, Tyre-Krusek or the Gale model, and determine whether or not you need more imaging or more surveillance. So what if someone is diagnosed with breast cancer? There's different kinds of cells in the breast, different kind of tissue. Remember, the breast typically makes milk. It's a mammary gland, and the lobules, they create and produce milk, and that milk travels through ducts. So the most common type of breast cancer is ductal carcinoma in situ, right? That's breast cancer that is in the ducts. The second most common is lobular breast cancer. This is a cancer that occurs in the lobules that are producing milk. And there's other kinds of breast cancer, like inflammatory breast cancer or Paget's disease, and about 12 or 13 other types. But the two most common are ductal carcinoma in situ and lobular carcinoma. So knowing the type of cell is important. Then, is that breast cancer localized? Is it tiny and small and just in a duct or in a lobule? Or is it invasive and more aggressive? Has it grown past the duct, past the lobule, and now is invading other tissue, other surrounding tissue in the area? Has it spread to a lymph node in the underarms or around the neck or around the collarbone or the clavicle? When we talk about spread, we talk about whether or not there's nodal involvement and whether there's metastasis. Is there another site in the body that has the breast cancer? So we're looking to see nodal involvement, where the tumor is, how big it is, and whether there's metastasis. All right, so that gives us a lot of information, but then when the breast cancer is being diagnosed, it's important to actually look at those cells and look at the genetics of those cells and what they're going to be susceptible to. Do they have estrogen receptors? Do they have progesterone receptors? Do they have human epidermal growth factor receptors or HER2 receptors? All of those pieces of information help your care provider decide what is the very best treatment. So it's, where is it located? Is it aggressive or invasive? Is it spread to lymph nodes or other parts of the body? And what kind of receptors are on those cancer cells? Are there hormone receptors, estrogen, progesterone, or HER2? Or are there no receptors? Is this a triple negative breast cancer? So there's no receptors. Triple negative means no estrogen, no progesterone, no HER2. All of those things come into play as your provider decides what's the very best way to treat and manage this breast cancer. So if you like this information, of course, please click like and subscribe. Please leave a comment or a question below, because it's important for me to know if this is valuable and the other information you might like. If there's a diagnosis of breast cancer, it's also really important to get the support that the person needs. Because we know that having support with other people who are experiencing the same diagnosis is one of the best ways for a person to have a higher quality of life and actually to live longer. Because if breast cancer is caught really early, 9 times out of 10, that person is going to survive and go on to live a long and happy life. But the treatments can be disruptive. And there's a lot of side effects for treatments, and knowing how to manage those and knowing how to manage all of the feelings that come up, if there's surgery, if there's radiation, if there's chemotherapy, it can really help to have a supportive group of people going through the same thing. I hope this has been helpful. And if you've been diagnosed, I want to wish you the very best of luck. Please take good care of yourself.